Welcome back to H360 Live. We're here with Lily Safani, the CEO of Gildas Club, which is a free comprehensive cancer program that includes support groups, educational lectures, and healthy lifestyle workshops, such as the John Lennon Real Love Project for everyone impacted by cancer, men, women, teens, and children. Gilda's Club was named after Gilda Radner, an original cast member of SNL. She was diagnosed with cancer in 1986. She found that she was able to express her true feelings regarding her cancer diagnosis after joining a support group in California. Her wish was that everyone touched by cancer would be able to receive the kind of emotional and social support that she found. Following her death in 1989, her husband, Gene Wilder, and Joanna Bull founded Gilda's Club. Well, thank you for joining us, Lily.
Thank you so much, Dave.
So your background is not originally in healthcare. You come out of the financial institutions industry.
That's right.
What ultimately led you into healthcare?
What really happened is the financial services industry was really going through a lot of restructuring, and quite honestly, when 9/11 happened, there was really, made it very difficult for my business, which was a direct marketing consulting firm, to really get a lot of work. And at the same time, I had some other interesting and wonderful life events happen. I gave birth to twin daughters. And during this time when everyone was regrouping about what we should be doing in financial services and my business was really slow, I decided that I had to really rethink what I wanted to do. My office space was being reclaimed on Madison Avenue. And with my children, I really thought that I didn't really want the pace of job that I had before, and I wanted to look at something different. A nonprofit came to mind. And originally, to be honest with you, I was not thinking about healthcare. My family is in the art business, and I was thinking in the lines of the arts. But through my connections, I was offered a job at North General Hospital, which at the time was the only private hospital in Harlem. And I was offered the job of Vice President of Development and Marketing and Communications. And because it was so different in some ways from what I was doing, because I was working in financial services marketing, but at the same time, the fact that it was very much like what I was doing, which was relationship building, fundraising in a different way, but helping people raise money, I decided that I would try this and see if I liked healthcare. And I quite honestly, I didn't really know that much about healthcare. But I became so fascinated by healthcare and the disparities really between the healthcare that I received as a white American woman versus someone who is African American and lives in Harlem.
Right.
And the challenges. And I decided to learn as much as I could about healthcare, Medicaid, Medicare, and it was an amazing experience for me. And then from there, I went to work for hospice. Which at the time, many of my friends thought, oh, hospice,
right,
you know, about death and dying. But quite honestly, it is one of the best federal benefits that we can offer people. And I really started to realize that dying is really more about how you die and the quality of life you have, and anything you can do to make someone's life better during that period of time is really incredible. And quite honestly, we are all going to die, and in some ways we can control to a certain degree how we die, and maybe not the disease and the actual cause of death, but we can do a lot. And it is very enlightening, quite honestly. And I learned so much more about Medicare, Medicaid, really how our health system works. Mm-hmm. And then from there, an opportunity came up for Gildas Club, and quite honestly, most of the people who are in hospice, about 70% of them are cancer patients. Mm. And so I had always wanted to run a nonprofit. That was really my goal. And when this position came, I thought it was just perfect because I had all the skill sets that I needed at that point. I had worked in the hospital and healthcare community, and I really did want to make a difference. And it's just it's just a great organization. It was in trouble at the time, and I love challenges, and I have a finance background, so it was perfect for me. And when I went there, and now it's 11 years, I never thought I would be there that long, to be honest with you. Not because I don't know, I just thought there'd be another challenge, but I just fell in love with the place and the people, the community, everything about it.
And tell me a little about what goes on at Gildas Club. What are some of the services that you provide to people that come in the door at your clubhouse?
I think the best way I can give you an example of what the services are that we provide is sort of give you an example of a family. A mother who has metastatic cancer, who just found out she's diagnosed with cancer. She's overwhelmed, she's angry, and somewhat isolated. At the same time, she has a husband, she has a child, and she has a job. And she's starting to think, well, how am I going to manage all of this? And someone tells her about Gildas Club. And she comes to Gildas Club, and the first thing she finds out is she goes to a support group. And she meets other people. And they're all going through what she's going through, maybe at different stages. Some are newly diagnosed, some are in treatment, post-treatment. But they all have the same kind of experience. And they share what we like to call at Gildas Club collective wisdom. And in her case, she goes there and she's able to tell her story and listen to other people's stories. So while she's getting help from everyone in the room, she has an opportunity to help other people.
Sure.
So every week, let's say it's Thursday night, she really looks forward to coming into this room. It's only a room, but it's a room with a group of people that understands what she's going through. And at the same time, she goes with her husband. Because just like her, but differently, he's impacted by the cancer.
100%.
He's worried about her. He's the caregiver. He's worried about finances. He feels guilty because he's not sick. And he's not sure how to communicate with her. But now he's in a room with caregivers.
With other men that are
and
going
other
through the same
men
journey.
and women who are going through this. And they all can talk about their anger, their fears, how to get through the day. And so when Thursday comes around for him, he's really looking forward to going into that room and talking about what's going on.
Yeah.
And then there's their daughter. She's 9 years old. She knows something's going on that, when her parents are trying to explain to her. She goes to Noogie Land, and everyone in that room, every kid, knows exactly what it's like to live with a parent with cancer. Parents losing hair, parents sometimes being lethargic, not feeling well, maybe they can't come to school for activities. But they're not crying, or they're in a community, they're laughing. They finally found a group of kids who just understand what it means like having a parent who's sick.
Right.
And so every week when they come in, the wife goes upstairs to her room, the husband goes upstairs to his room, and their daughter runs downstairs very happy that she's going to be with a group of her friends.
Yeah.
And this is what goes on at Gildas Club. And it's not, those are the support groups. We have Noogie Land for the kids.
Yeah.
We have, a wellness group for someone who's diagnosed with cancer, a family group for the husband, but then we have other activities. There's Family Fun Night, which is when we show a film that is appropriate for all age groups. Parents come with their kids, we serve pizza, parents can talk among themselves, the kids lie on these big pillows and watch a movie. Last week it was Sing, and they had a great time. Then there'll be workshops. Stress reduction workshops, yoga, what else? There's stress reduction, there's healthy lifestyle nutrition programs, there's Zumba, there will be art classes, there'll be also other movies to watch. There's so many different programs, and the workshops, and actually this is where Joe came in, the workshops are very dynamic. They constantly change. They're all brought in by professionals who volunteer their time, but they're all different. And the members really come to look forward to them because they're an opportunity for them to really relax and be with their friends, and they really form friendships. They look forward to those days when they come. So they're really a very important part of our program. and everything is for free.
Yeah.
So no one has to worry about paying anything, they just have to show up.
Yeah. We can fully understand what you're talking about because we do the same thing with our community, but it's online. So for those that don't live in an area with Gildas Club, they can come to HealthTalk. And the reason we call it HealthTalk, we're a video-based platform because we think that video and seeing somebody versus just reading about it is a different form of communication and a better form. And 360, because I agree with you, everybody has a view of that patient through a different lens. The patient feels one way, the caregiver feels is going through another set of emotions, the family members, the friends of the patient. So we get that. And so providing those things, and by the way, in our opinion, it's an and, not an or. We like supporting, and we like the fact that it's face-to-face. Unfortunately, due to some complications of surgeries and radiation and chemo, everybody can't always make the Thursday meeting. So one of the things that we are challenged with online, and I'm sure you are in a physical community, in person, is keeping content fresh, new ideas, new activities. What's the next thing? What can we have that these folks are going to look forward to coming and getting engaged in? And then one day your phone rings and it's this guy, Joe. And he says, hey, I got this idea, right? And and John Lennon and guitars and singing, and what goes through your mind? Take me back to that day when you pick up the phone and you say, wow, all right, we may have something here, but I'm going to vet this guy out a little bit.
Well, quite honestly, I get a lot of cold calls, and Joe was a cold call. And he did mention, at least, that it was theater within, and that piqued my interest. But when he said John Lennon, you have to understand, I grew up with the Beatles.
Yeah.
So the idea of John Lennon, and he started to describe his program, I immediately just fell in love with the idea. And also because I really believe, and just through my career in healthcare, that creativity, and especially in hospice, it is a big thing, using creativity to help people focus their mind on other things other than their health condition. And so the whole idea of this and music, and we hadn't been doing anything in music. We do a lot of art, we do writing, we've done some writing in the past, but we had never done a music program. And when he was talking about guitars and teaching people how to use guitars and children, I thought, wow, this is a great idea. Mm-hmm. And I told him that I was going to talk to, the program people on my staff, and then we would set up a meeting. And it was very interesting. I did have to do a little convincing, and more so because I think I come at a time when the Beatles were really important to me. And so I fully understood when you talked about John Lennon, what we're talking about. I mean, to me, that was amazing. But some of the people that I was talking to were younger. And sometimes it's hard to imagine a new program and how it will work, and especially a music program. We had never done anything like that, but I actually could easily imagine it. And so I talked about it with my staff, and quite honestly, I was very persistent about it because I really thought it was going to work. And so I really just said, we have to meet with Joe, and I'm sure we can make this work, and I think it's definitely worth a try. And so they met with Joe, and we started talking about how we would make it happen. And it was a little complicated for us.
Was it a hard sell, Joe? You get there for the meeting and...
Oh, I don't think
Well, no, it wasn't a hard sell. I wouldn't call it a hard sell. I mean, Lily was supportive and warm, and I think that that I intuited that she wanted this to happen. So no, but there's always a bit of nerves, when you start something. Is this going to work, or how's it going to work exactly? And we were testing it, even though we had done the program before. We were really testing it, and we spent that fall of 2015 and 2016 testing it, really, experimenting with it. Yeah. It was just recently really for the first time that we brought the program to the children's group at Noogie Land with a parent who's going through the cancer journey. We'd never done that before. So that was something new. And
So what was that? So now you've got a parent in there.
no, the parents aren't there.
Okay.
Just there. Again, it's a remarkable thing. First of all, kids are amazing. I told the story to you before, but I'm going to tell it again because it's maybe my favorite story of the kids group. So we're in there, and they're and Stephanie's teaching these kids, and she says to them, she's got a guitar and she's playing some chords, and she says to the kids, well, do you know who the Beatles are? Yeah, I know who the Beatles are. Everyone says, yeah, they know the Beatles. They're a group, yeah. And she says, well, does anyone know who John Lennon is? And one little girl says, I know who John Lennon is. He was shot. She says it like yeah, he was shot. And so proud that she knows. And Stephanie was great. Oh yeah, that's right. He was shot. The bad man shot him. And what the kids work in a group process. So they actually create a song. Each workshop they create a song. They're so free. The thing about it is the cancer part of it, that they have a parent, that never comes up in the now it might in some way, because when we're talking about writing the song, someone may say, I love my mommy, and that becomes part of the song.
Sure. Yeah.
Or I don't want to die, and something might come up that you could say, oh well, you don't always know. It's hard to measure the impact at times of what a gift like this is.
Yeah.
It's in the room, but it's not like a heads-on thing. You understand what I'm...
Sure.
And it's that way for the adults as well.
Absolutely.
It isn't like we're getting together and say, let's write songs about our tumors or our operation. No, when talk of cancer, when talk of treatment, when talk of that, that journey comes up. It comes up in an organic way. Mm-hmm. It's not something that we look to pull out of the participants. And I think that's one of the things that makes the workshop so vital, because I don't think people feel like they're coming into it, I'm in a cancer music workshop, or that's not what it is.
Right.
Yeah. None of our workshops are really dealing, unless we're talking about perhaps nutrition, but it's more about healthy living, and anyone can really attend the workshop, because it's open to caregivers, so people who don't have cancer. I mean, the idea behind the workshops is really to help you live your life, to have the freedom to enjoy the moments of exercise or dancing or drawing, learning how to express yourself. So I think what you see in, for instance, your workshops and music workshops, is that this is an opportunity for them to try something different, and for someone to guide them in trying something different. And that's really what makes the difference. And it's really in the support groups that they have the opportunity to really talk about their cancer and what is going on in their lives with regard to the cancer. And in some ways, the support groups become their lifeline for that aspect of their life.
Yeah, yeah. And no two journeys are the same.
Right.
I had a call the other day from a lady that said, I've had a really tough day. And I said, well, what happened? She said, well, I had a little bit of a confrontation with my physician. And I said, well, what about? And she said, well, the therapy that he was going to prescribe has a tendency to give neuropathy in the fingers. And she says, the one joy I have in life is sitting down behind my piano and playing music. And she said, that brings me happiness. And I am not going to go through a treatment where I'm going to have neuropathy in my fingers. What's plan B? Because I'm not doing plan A. And so the journey is so individualized. Right. And I just love to hear what you're doing, because you're not in there, and even the workshop, you're not focused on the cancer. You're focused on life and emotion and relationships, and everyone's going to die, and everyone, I believe, is dealt this hand of cards. And some people are gonna, and it's how you play your cards through the journey of life that's gonna depend on whether you're gonna be happy or sad or positive or negative or have good clinical outcomes or, there's things we can't control and there's things that we can control. So Joe comes in, he meets with your staff, we lay out the program, and
Right.
it's the big night, it's the curtain raising, it's the first workshop.
It wasn't that dramatic.
Huh?
Really.
Yeah,
What?
no, it
It
was
wasn't
really-
that.
yeah.
It
Did
wasn't that.
the guitars show up on time and everybody's there?
All that stuff. It's really not that dramatic. I mean,
Yeah.
it's pretty. You guys, Lily reminded me the first group was a teen group. Was the first group about it. I'll say this from our perspective. The Theater Within goes back to 1962. It was originally founded as Theater of Encounter by Alec Rubin. Alec changed the name to Theater Within in the 70s. There's a long history of workshops here. The workshops have always been transformational workshops. They've always come from the point of view that we're all creative, and that being creative is essential to one being whole. It's essential to one's life. And it's important to open the heart and open the voice and let your story, in whatever form it wants to take, or your creative expression, come forward. There's a healing aspect to that. I'm a little afraid of that word healing. That's why I say wholeness. For all of us, it's amazing to bring that kind of work to this community. It's tremendously satisfying for us to see the impact that it's having. And while I said that that cancer doesn't come up often, it's not to say it never comes up. It does come up, and people do write songs about it. And when that happens, sometimes the songs are funny. I remember someone writing a song about a lump, and it was lumpity lumpity lump, and she wrote this lump, and the workshop leader just put a little beat to it, and she wrote this verse about this light going against it. I mean, wow.
Right.
It's
Life changing.
So that's an example of one way to relate to it. And other times it could be heartbreaking.
Yeah.
It's a safe place. Gildas Club is a safe environment, and then the way we do these workshops, they're protective. I mean, you're not allowed to bring a friend with you. It's a closed group. It's a group for the workshop leaders. We've had a seeing eye dog. That's it. Right. One of the participants with cancer and blind, so a seeing eye. But so we create a really safe space.
Yeah.
If a guest comes down, we politely ask the guest to really create a container, kind of a sacred space, really,
Sure.
where people are empowered and have permission to really let it rip. Whatever needs to come forward, to let it come forward, and that's good for all of us, cancer or not,
Sure.
to be encouraged in that way.
Well, Lily, you call your offices a clubhouse, right?
Right.
And so tell me a little more about your organization and where can we find you and how can we support what you're doing?
So our organization is a clubhouse, but when we were founded in 1995, it was really, the clubhouse was going to be the only place in which our members could come, and they can come for support groups, educational lectures, healthy lifestyle workshops, and also social activities. We are a community, and we do celebrate. We celebrate holidays. We celebrate Halloween. We have a very robust Halloween called Noogie Fest, and everyone dresses up in Halloween costumes, including the staff. And we decorate our clubhouse. And this past year, it was decorated in a Harry Potter theme, which was really amazing. We also have a holiday party, a birthday party, and we remember the people who we've lost annually. And also, we celebrate our volunteers because they're very important. But in addition to that, we also are out in hospitals. We have our Gilda Comes to You program. So we are at Kings County Cancer Center, we're at Mount Sinai, we're at Queens Cancer Center, and we're also at Montefiore. And we really feel it's important to bring our program to the underserved populations, and the best way to do that is really to be in the hospitals, in the neighborhoods where more underserved people are, who are uninsured, where English may not be their first language. And that's a very important focus of our mission. But what's really important for us, and I guess what really defines us, is the word community. I mean, we're made up of obviously our cancer patients and their families, but we're also made up of volunteers. We have over 300 volunteers who support our program. We're made up of mental health professionals, not only our staff who come and run our program. We're certainly made up of our donors who are very important, because our program is free. 95% of our program is privately funded. So quite honestly, there are so many different ways someone can support us. They can come and volunteer for us. There really isn't, a number of days that you have to volunteer for us. There's no prerequisite. There's just a need, and if you can fulfill that need, then absolutely, we want you there. And certainly donations, third-party events. We have, for example, an organization that originally started from Sony, 10 Bands, One Cause. Every year, they select 10 bands, and they develop pink vinyl records, and they sell them, and we are the lucky beneficiary of that. So there are so many different ways, but if someone actually needs cancer support, whether they're living with someone or they're diagnosed with cancer, a family, they should either go to our website, gildasclubnyc.org, or they should call us at 212-647-9700. We are definitely a very important cancer resource, but we're, in some cases, not very well known. Social workers, doctors, those are the people that refer us, and friends and family, but very much grassroots. So anyone who can spread the word for us and let people know that we're there for them and that we're 100% free, we consider that a big support.
Yeah. Now, Lily, are there other clubhouses around the country?
Yes, we are the founding organization, founded by Gilda Radner and Jean Wilder and Joanna Bull. But there are Gildas Clubs and also cancer support communities. We're all under the same umbrella all around the country. So if you look up Cancer Support Community, they will have a list of locations around the United States. So if you're not living in New York and you're living in Florida, Miami, Nashville, Louisville, in San Francisco, LA, Chicago, Dallas, there's about 40 of us around the United States. So I would definitely say go on the website and you can find out, or you can even call any one of us and we will refer you.
Yeah. Well, the Cancer Support Community is a great organization. We've had Linda House as a guest on our show a couple of times, and we really appreciate the work that she's doing as well. So it sounds like you guys are off to a good thing here. The workshop, fantastic, really inspiring. And Joe, I'm going to give you the last word.
So long. I'll come back to what I said before. I think there's something that feels, I'm going to say, righteous about the John Lennon Gilda Radner connection. Spiritually, it just feels right, and the fact that everything is free at Gildas Club, it also fits in with our model as well, because that is our model for our workshops. We don't charge for them. We're looking for people we can bring them to. So. It's a beautiful thing to do a beautiful thing.
Yeah. Well put. Well, Joe, Lily, thanks for joining me.
Thank you.
I really appreciate it. Thanks.
Thanks.